Welcome to Doctors Hospital of Manteca Weight Loss Surgery Seminar. We are a center of Blue Distinction for Bariatric Surgery and accredited under the Metabolic and Bariatric Surgery Accreditation and Quality Improvement Program. On our website, you can find a list of our services. Specifically, bariatric surgery has its own tab. You can click into that and get more information about our program. Today, I'm going to share a little bit of information with you about weight loss surgery and our program. This is some of the tools on our website. On the bottom left-hand corner, you will see the BMI calculator. The BMI calculator is a simple calculation of your height and weight, which results in a body mass index number that gives you an indication of your overall health. Are you healthy? Are you leaning towards obese or mildly obese and qualifying for surgery? So when is it time to have weight loss surgery? There's a couple of questions you should be asking yourself to see if you are ready to have weight loss surgery. One of the questions is, do I struggle with health conditions such as type 2 diabetes, high blood pressure, or sleep apnea? Another question is, do I feel like people see or treat me differently because of my weight? Is my weight standing in the way of me getting a job or keeping a job? How many times have I tried to lose weight and is it working? How do you feel about the way you look in photos? Does your weight affect things that you can do with your family? And lastly, but most important, are you ready to make changes in your life to help keep the weight off? If you're answering yes to any of these questions, it might be the right time to consider weight loss surgery, and we're so glad you're here to join us for our seminar. We want you to know that obesity is a disease that is impacted by many factors. A lot of people feel like being overweight is their fault. Well, we're here to share with you that we know obesity isn't just a matter of eating and exercise. It is a combination of many factors in our lives that create a challenge with obesity. Some of these things include working long hours and spending time commuting. Our cultural beliefs and practices related to food, how we eat, and what we eat affect obesity. The United States is known for incredibly huge portions of food, and if you're like me and you come from the Clean Your Plate Club, you may eat everything on that plate, which is way more food than we need, but directly related to what I've been taught is what I'm supposed to do. You may also have issues with affordability of food and purchasing healthy food. We know that it's easier to buy a $10 pizza that feeds a family of 5 than to cook something like chicken and broccoli, which may cost $20 to $25 purchase. So affordable food and access to affordable food can be difficult. And then there's lots of pervasive food advertising out there that makes us want to eat foods that may not be healthy. We want you to know that obesity is a disease. Obesity is not your fault, and there are ways to help. Obesity as a disease relates to lots of other diseases. Some of the diseases related to obesity include cardiomyopathy, which is an enlarged heart, diabetes, hypertension, obstructive sleep apnea, joint pain. We've recently discovered that obesity itself is linked to numerous cancers. People with obesity are challenged with high cholesterol, gallbladder disease, liver disease. The new one that we've discovered is obesity is related to polycystic ovarian syndrome, which can cause challenges with infertility for people who are obese. And then obesity itself as a disease can lead to an overall poor quality of life and potential premature death. Research shows that people who are obese do not live a normal lifespan and can die up to 10 years sooner than we expect related to obesity. So what qualifies somebody for weight loss surgery when they're struggling with obesity and obesity-related diseases? Again, I'm going to bring you back to that body mass index, that BMI calculator that you saw on one of the first pages we showed you. You can go to doctorshospitalmanteca.com and review the body mass index calculator. You'll put in your height and your weight, and it's going to give you a number. If your BMI is greater than 35, and you have any of the diseases related to obesity that we discussed previously, those are called comorbidities, you would qualify for surgery. If your BMI is over 40, you qualify for surgery. So go back to that website, put in your height and weight in that body mass index calculator, and see where you land. If you land over 40, you're going to qualify for surgery. If your BMI is 35 to 40, and you have any of those comorbid conditions, you would qualify for surgery too. Most insurances pay for surgery, which is great, and they have specific criteria that needs to be met. We're gonna go over those criteria shortly. The other criteria for weight loss surgery is that you had to have tried some diets before and not been successful on them. And the last and most important thing as a criteria for weight loss surgery is to make sure that you're motivated to make lifestyle changes. So what are the requirements for weight loss surgery? WLS stands for weight loss surgery, just in case you're wondering. There are standard requirements based on our accreditation, and one of the first ones is to attend the weight loss surgery seminar. And you're doing that right now, so congratulations, you're one step closer to your weight loss surgery. Once you've decided on a surgery team, a surgeon, you're going to have monthly appointments with the weight loss medical team, and you may do that for up to 6 months. It just depends on the insurance requirement. Insurances require dietary journaling and some pre-op weight loss attempts, but you don't actually have to keep the weight off. You just have to show that you've tried other programs and not been successful with long-term weight loss. All of the candidates in our program go through a psychological evaluation, and that's not big and scary. What that means is we're making sure that you are ready for the changes that you're about to make in your life. So don't be worried about that evaluation. It's really just to make sure that you are ready for this. Every patient gets a nutrition assessment to see how they're eating, what they're eating, and what it will look like in the future with some nutritional changes. If you have any specialty physicians that you have as part of your medical team, like a heart doctor or a lung doctor, those doctors would need to give clearance for you to have surgery. And then once you've met all of these requirements, you will attend a pre-op class at the hospital that you're going to have surgery at, and we'll run through lots of information and help set expectations about what's going to happen in the hospital before and after. After surgery, we encourage you to attend a support group, and if you want, we can help coordinate an exercise program before and after surgery for you. There's lots of options, and these are the requirements for weight loss surgery. There are great benefits to having weight loss surgery. We see disease resolution after weight loss surgery for most of our patients. If you're struggling with diabetes or hypertension, we see that go away within a short period of time after having weight loss. People also experience less pain in their joint. They sleep better because their sleep apnea is resolved, and if they have asthma, that improves as well. People feel better after weight loss surgery. Now, everybody wants to know, well, what's the risk of having surgery? The good news is that the risk of having weight loss surgery is similar to having your gallbladder removed. All surgery has risk, but it's similar to having your gallbladder removed. So hopefully that makes you feel a little bit better about the risk of surgery. Patients usually stay in the hospital one night and then you go home. We offer a specialized team here at Doctors Hospital of Manteca. We are accredited under MBSAQIP, which is the Metabolic and Bariatric Surgery Accreditation Quality Improvement Program. We've been a center of bariatric excellence since 2018 with Blue Cross, and we've been performing weight loss surgery since before 2002. We have a medical director that supervises our entire program. We have a certified nurse coordinator, and we have a certified metabolic and bariatric surgical clinical reviewer that does all of the data analysis to share with us at our program meetings. Each of the nurses at Doctors Hospital of Manteca does yearly education for the care of patients having bariatric surgery and the care of all patients that are of size. We also are committed to the surgical process and the team and have a committee that meets 3 times a year. It comes together with our interdisciplinary team to make sure that we are giving the highest quality care to our patients. We have specialized equipment at Doctors Hospital of Manteca to care for patients, and you'll see on this list on the screen that there is pretty much everything under the sun that we could need to help care for our patients of size. We have larger walkers and commodes. We have larger visiting sections for people to sit. The patients' recliners are larger. We have 24-hour respiratory support. We have one of the largest CTs in the Tri-Valley area. We have special lifts. We have special equipment in the OR, and we have special beds that go up to 1,000 pounds for our patients. So we are well equipped to care for patients here at this hospital. All right, now to the nitty-gritty. Let's talk about what type of weight loss surgeries we offer here at Doctors Hospital Manteca. We offer 3 types of weight loss surgeries: the sleeve gastrectomy, also known as a gastric sleeve, the gastric bypass, also known as a Roux-en-Y, and then we offer 2 forms of the duodenal switch. We offer a standard duodenal switch and a duodenal switch loop. I'll explain those to you both in the next few slides. This first slide is our sleeve gastrectomy, or a gastric sleeve. The surgery is laparoscopic, so there's no big incisions. We restrict the size of the stomach to about the size of a really small banana, roughly 4 to 5 ounces or even smaller. We remove that portion of your stomach, which is roughly 2/3 of it, and people have a much smaller stomach. So with a smaller stomach, you eat less and you lose weight. The great thing about a sleeve gastrectomy is there's minimal risk of nutrient and vitamin deficiencies. There's no adjustments needed like with a lap band, and there's no dumping syndrome associated with sleeve gastrectomy. It is irreversible though, because we do remove 2/3 of your stomach, and we remove that 2/3 of your stomach through a small port that's been placed when we do the surgery. Most people who have this surgery lose, on average, 50 to 60% of their excess body weight. So when you think about how much weight you have to lose, most of our weight loss patients need to lose roughly 100 pounds or more. So with the sleeve gastrectomy, you can reasonably expect to lose about 50 to 60 pounds if you're 100 pounds overweight. Now, depending on your level of commitment to lifestyle change, diet, and exercise, you could lose 100% of your excess body weight with the sleeve gastrectomy if you wanted to. The sleeve gastrectomy is currently the most commonly performed weight loss surgery across all the United States. This is the gastric bypass. It is our oldest procedure. It's been performed since the 1960s. We have a great depth of research and knowledge about this procedure. They restrict your stomach to the size of a 1-ounce pouch, which is roughly the size of a small egg or a shot glass. The gastric bypass is 100% reversible, which means the doctors can put you back together the way you were. They can't do that with the gastric sleeve because we remove 2/3 of the stomach. So this surgery is a little bit different, and again, it's 100% reversible. There is a small stomach and a big stomach. Food only goes into that small stomach, and then food travels down a short piece of the intestines that has been attached to that small stomach. The big stomach is still connected to the intestines. The gastric acids and enzymes that help break down food travel from the big stomach down to where the small stomach and the intestines now meet. And that's only a small portion of the intestines that's bypassed. With this surgery, there can be malabsorption of vitamins, minerals, and iron. So it's very important that you take a multivitamin every single day to help prevent any kind of vitamin or mineral deficiencies. The stomach is very small, and it's difficult to get in all of the vitamins and minerals that you need without taking a vitamin supplement. So you will need to take a vitamin supplement every day. With the gastric bypass, there is a condition known as dumping syndrome. Dumping syndrome is usually related to adding fluid to the food that we're eating so that it liquefies and then dumps it right through your body into your intestines. What's unique with the gastric bypass is we bypass a part of your body called the pylorus. Now, since you're bypassing the pylorus, you don't have the ability to use that to regulate food into your intestines. So you have to be a little more cautious with this surgery to avoid having dumping syndrome. The good news is dumping syndrome is self-limiting. Doesn't feel very good when it happens, but it does go away. One of the challenges with the gastric bypass is people do run the risk of having a bowel obstruction complication or ulcers. So some of the things we can do to prevent that is making sure that we chew our food, and you're going to chew it 30 times with each bite, and then avoid certain things that can cause ulcers. There's a drug classification called non-steroidal anti-inflammatory drugs that need to be avoided when you have a gastric bypass because there's an association to ulcers. Also, if you're a smoker, this may not be the best surgery for you. And if you have a history of ulcers related to stress or any other reason, this might not be the best choice for you. You would want to consult your surgeon and your physician to decide what surgery makes the most sense. The great news about the gastric bypass is people lose on average 70 to 80% of their excess body weight. The next surgery that we offer is called the loop duodenal switch. The loop duodenal switch is a great surgery for people who have a BMI over 35. This surgery is very similar to the standard duodenal switch. It has a little less complications with bile reflux, ulcers, and risk of internal hernias, as well as malnutrition, because of the length of the intestines. With both duodenal switches, the surgeons do a sleeve gastrectomy, and then they alter the way food moves through the intestines. So the average person's intestines is roughly 30 feet long. Food moves through your body once it gets to your stomach. It moves through all portions of your intestines, and minerals and vitamins and water, fluid is taken out through your intestines and used through your body, and then you excrete what's left over. But with these surgeries, the doctors shorten the bowel so that food only passes through a small portion of the intestine. With the loop duodenal switch, on average, a patient has about 9 feet of intestines that food will pass through. And food will be absorbed through those 9 feet of intestines. But it's a little bit different because now it's not 30 feet long. With the next surgery, the standard duodenal switch, the intestines are shortened to about 4 feet in which food moves through them. Now, for both of these procedures, your intestines, all 30 feet, stays inside you. We don't remove anything. We just change the pathway that food moves through your intestines and how it's absorbed. The standard duodenal switch is for patients who have a BMI greater than 50. We know they lose quite a bit of weight with this surgery, and having only 4 feet of bowel to absorb food can result in some malabsorption of certain vitamins, specifically A, D, E, K, and calcium. And with these two surgeries, the protein intake is a little bit higher than our other surgeries. The protein intake for the standard and loop duodenal switch is 80 to 100 grams a day. Again, there is a sleeve gastrectomy performed with the duodenal switch, so there will be permanent loss of 2/3 of your stomach, which is removed. And then the length of intestines that food travels through is reduced. Each surgery is a little bit different, but no intestines are ever removed from patients. The challenge with these two types of surgeries with the shortened bowel is that people can have more frequent bowel movements, and in the beginning they may experience diarrhea-like bowel movements, which can be a little concerning, but with dietary change and time, it gets better. The great news with these surgeries is people have lasting weight loss with minimal effort. It is the most aggressive of all of our surgeries, but the patients have very high follow-up rate and are very happy with the results. On average, they lose over 80% of their excess body weight. Now that sounds great, right? 80% of your excess body weight. But this might not be the right surgery for you. So whatever surgery you choose is a very private conversation between you and your medical team based on your medical history, your medications, and your level of commitment to lifestyle change. So where do you go from here? After our seminar today, we want you to go back to our website and visit it and get some more information about weight loss surgery. You can start with a bariatric assessment and see if you are ready to continue this journey. You can certainly call for a referral to our surgeons, and you can request a phone call with our nurse coordinator. You can do it from our website, or you can call us right here from this phone number. Thank you for joining us, Doctors Hospital of Manteca Weight Loss Surgery Program Seminar.